Nutritional Intake of Low SES Adults with HIV in Los Angeles County by Rosemary Garista, Euphrosina Gates, Cynthia Martinez, Kimberly Pell, and Elisa Ward. The goal of our program is to increase nutritional intake in low SES adults with HIV in Los Angeles County. Our targeted health behavior are the eating habits of low-income HIV adults. Targeting this health behavior is important because malnutrition is a predictor of worse outcomes in HIV-infected individuals. Our program will include 4 sessions. Session 1 will be presented by Cynthia, which will focus on coping skills. Session 2 will be presented by Elisa, which will focus on nutritional intake. Session 3 will be presented by Kimberly, which will be a food demonstration. Session 4 will be presented by Euphrosina on self-care and cognitive behavioral therapy, and Rosemary will discuss the health belief model. Here is Cynthia, who will discuss the first session on coping skills.
Physical health is not the only issue one has to deal with when infected with HIV. Along with physical illness are mental health conditions that may come up, such as depression and anxiety. Mental health refers to the overall well-being of a person, including a person's mood, emotions, and behavior. Many people are surprised when they learn that they have been infected with HIV. They experience a lot of feelings like confusion, frustration, worry, and some people feel overwhelmed by the changes that they will need to make in their lives. In this session, we are hoping to introduce coping skills that will help individuals deal with their diagnoses. This session is geared towards educating HIV-positive individuals on the importance of positive coping skills. This session will normalize emotions related to HIV and introduce healthy coping skills to deal with these emotions and physical feelings. So session 1 will be laid out like this. There will be an introduction with an icebreaker, followed by an activity called Bottled Emotions, and then an educational component. So for the activity Bottled Emotions, each member will write down their feelings associated with being HIV positive on a piece of paper and turn it in. The group facilitator will then collect all the papers and read them out loud. So this is to demonstrate similarities in their responses and to really show the group members that they are not the only ones experiencing these feelings. The group facilitator will then normalize these feelings and really emphasize that, things like this, like no matter what you are feeling, you have the right to feel that way. There are no wrong or right feelings. Feelings just are, they come and go. And you have choices about how you can respond to these feelings, and that's where we tie it into the coping skills. After that, the group facilitator will introduce the educational component that will cover, what are coping skills? What are some ways you cope? What are some ways you would want to cope? After that, the next slide shows the healthy versus unhealthy coping skills. And this is to really show the differences between an unhealthy and healthy alternatives. So, maybe some of the group members may associate or be really familiar with coping with things like denial, oversleeping, overeating, acting out, being aggressive. So then the facilitator will then, show the group members alternative ways they can deal with their diagnoses, such as, getting enough sleep at night, joining a support group, trying to find activities that relieve their stress, and most importantly, will cover things like limiting caffeine, nicotine, and alcohol and other substances, and also to eat small healthy meals, since this is really the focus of the overall program.
Session 2 of the program will deal with nutritional intake. The objective is to educate HIV-positive individuals on how good nutrition can improve their overall quality of life living with the disease, and also to provide nutrient-rich shopping lists. It is important that those individuals infected with HIV know that good nutrition keeps their immune system strong to help fight the disease, helps process medications and lessens their side effects, and helps make symptoms and complications of HIV more manageable. HIV infected individuals should aim to consume 17 calories per pound of their body weight if they are trying to maintain their weight. They should consume 20 calories per pound of their body weight if they have any type of infection. And they should consume 25 calories per pound of their body weight if they are trying to lose weight. An HIV positive man should aim to consume 100 to 150 grams of protein per day, and an HIV positive woman should aim to consume 80 to 100 grams of protein per day. HIV infected individuals should be sure they are consuming the proper amounts of carbohydrates each day. They can do so by eating 5 to 6 servings of fruits and vegetables each day, but they should avoid the carbohydrates found in sodas and sugary foods. They should consume foods that are rich in vitamin A, such as whole eggs, foods that are rich in B vitamins, such as meat, foods rich in vitamin C, such as citrus fruits, foods rich in vitamin E, such as green leafy vegetables, foods rich in selenium, such as whole grains, and foods rich in zinc, such as milk and other dairy products.
Session 3 is a food demonstration. The objective of the food demonstration is to educate, motivate, and increase the self-efficacy of HIV-positive individuals through active participation in their health through food preparation. Some people with HIV can have various complications that can interfere with nutritional intake. People with HIV often experience nutritional deficits that are commonly associated with a loss of appetite, diarrhea, nausea, vomiting, and sometimes mouth sores. Some recommendations and foods to help cope with these symptoms include eating soft, mashed, or moist foods such as avocados, squash, pumpkins, papayas, bananas, yogurts, cream vegetables, soups, pasta dishes, and minced food. Adding liquids can also be helpful in softening food. Using a straw for drinking fluids and chewing small pieces is also helpful. Some foods can cause stomach aches and diarrhea. People who have mouth sores or infections should stay away from foods that are difficult to swallow. Some other foods to avoid include very spicy and salty foods such as chilies and curries, acidic or very sour foods such as oranges, lemons, pineapple, vinegar, and tomatoes, foods and drinks that are too hot or too cold. Food should be kept at a room temperature. Foods that need a lot of chewing, such as raw vegetables, or sticky or hard to swallow foods like peanut butter, should also be avoided. Some people with HIV often have financial struggles from losing their jobs because of their poor health. Some of these people have even less access to food because of the stigma and the decreased ability to provide food for themselves. Educating and encouraging people with HIV to be active participants in their health is important in building self-efficacy. People with HIV can build their self-efficacy by selecting their groceries, whether by going to their local supermarket or by shopping online. Many stores such as Amazon Fresh, Safeway.com, and Vons deliver fresh food to homes daily.
So session 4 is about self-care. Really, in this session, we want folks to be able to increase their help asking behaviors. For the session, there will be a facilitated group discussion on self-care techniques. Motivational interviewing will be utilized and able to solicit techniques from the participants themselves. Also, if some techniques aren't covered, such as medication adherence, journaling as a self-reflective, evidence-based technique, which aims to help folks monitor their progress, build confidence, and reflect on what has been working and what has not been working, will be covered. Again, knowing when to ask for help in situations, so that we can practice kind of role playing and what that looks like, and people will have an idea of and being able to anticipate any hurdles that they might come across. Another self-care technique that we would go over, and hopefully that would be solicited from the group, would be appropriate exercise. Exercise combined with medication adherence especially increases cardiovascular and biochemical performance. Cardiovascular risk is definitely associated with an HIV diagnosis in a negative way, though exercise can help to mitigate that. The activity that would be using in the group would also be the cognitive behavior therapy chart. Cognitive behavior therapy, or CBT, was traditionally used to treat depression. Since then, it's been used to treat anxiety, substance abuse, and really it's to increase self-efficacy. So on this slide, as you can see, it has the think, do affects the way you feel. So from here, now that we understand what CBT is, we're going to go on to the next slide. In this session, we'll be using this chart. It's a cognitive behavior therapy chart. Really gives a way for you to, or individuals to see what their thoughts, emotions, behaviors are, how they're all interconnected, and how one of these elements definitely affect the other two affect an element. So you can see on the outer ring that you can identify a situation, write down the thoughts that you're having or emotions and what behaviors led to those, or vice versa. Also, you can fill in the body sensation portion, where you can document the physiological changes that you're experiencing, maybe the hairs on the back of your neck standing, or that feeling in your gut that something wasn't right, or sweaty palms. This gives a good way to take the situation and really analyze it, be able to reflect and understand how it is that all of these elements are interplay with each other. And we'll be using this for session 4.
Our intervention uses constructs from the health belief model to increase the nutritional intake in low SES adults with HIV. We applied the constructs of perceived benefits, perceived barriers, and self-efficacy to our intervention. Perceived barriers is one's belief in the physical and psychological costs of adopting the advised behavior. Our intervention is designed to identify the possible barriers that low-income HIV patients may face when trying to increase their nutritional intake. For instance, HIV individuals can experience loss of appetite, or they may not have access to healthy foods. But our goal is to reduce barriers through reassurance and support. We discuss how to overcome the barriers with patients through the food demonstrations and coping skills workshops. The construct of perceived benefits is defined as a positive expectation that by taking a recommended action, the person will avoid a negative health condition. In the context of our intervention, we emphasize to HIV patients that increasing their nutritional intake can provide many benefits, such as keeping their immune system stronger, help manage HIV symptoms, reduce the risk of complications, better process medications, and manage their side effects, but most importantly, improve their overall quality of life. Self-efficacy is the belief that one can successfully take a recommended health action. Our intervention seeks to provide training and guidance to HIV patients so that they feel confident enough to increase their nutritional intake. The 4 workshops, which focus on healthy coping skills, food demonstrations, a nutritional intake lesson, and self-care tips, are designed to prepare these individuals for the intended behavior change.
For outcomes, we'll be using a combination of nutritional intake changes, improved or unchanged health, and then how will they be measured. There's a pre-post test survey, dietary screener that we'll be using, and a simple Likert scale with the feelings of, with the identification of feeling healthy or unhealthy. For the dietary screener, we'll be using a screener from the National Health and Nutrition Examination Survey. This is designed to assess the health and nutrition status of adults. It uses an exam and a self-reported survey. This is put out by the CDC, the Centers for Disease Control and Prevention, and it is able to track the nutritional progress based on portion size, fiber, whole grain, sugars, dairy, calcium, and red meat, really to give a full understanding of where a person's at in relation to nutritional intake.